For ARRT, for procedures under the head section, and again, this will be 18 questions. These are what they list as possible areas to have questions on. Some tips I have for head are to review these positioning areas: skull, facial bones, sinuses, mandible, zygomatic arches. TMJs, nasal bones, orbits would be small. Don't spend a lot of time on those. Know your positioning lines. Remember that 7 degree of separation between your lines. Landmarks. Review those method names in your textbook. Central rays, tube angles. Remember, any alternate tube angles would be if the patient's normally PA, now they're flipped AP, so say like a PA Caldwell or something, and they're asking you about an AP Caldwell, you would reverse tube directions. Alternate views might be a trauma situation. Image evaluation, how do you evaluate for rotation, tilt, artifact, etc. Usually for sinuses, the key is that they're upright. For air fluid levels, and then the cross-table lateral option would be used for trauma. Petrus ridges, that's the key for head positioning, and I know you've heard me say that a million times, but Petrus ridges are the key to knowing if you're in correct position. And if you think about it, there's not a ton of head stuff. For these lines, go with the ones that we use most often. We don't tend to use this GML a lot. The OML, IOML, you guys know those. We use those all the time. AML. The LML we don't use often either. Mental meatal we use all the time, and you know the EAM. I would love for you guys to work on a chart like this, or write out your own chart and see if you can fill them in, remembering which of the headwork has a lateral, which uses a Caldwell. Does one have an AP or PA? Which ones use Townes, Waters, SMV, etc.? So if you would just write it out on a scratch paper, give yourself a few seconds, fill it in, and then check your work. Petrus ridge location for each of the common head positions, and you'll notice some similarities here. Only the PA skull is going to fill your orbit. For the lower third, look at the name of all of them. Skull Caldwell, facial bones Caldwell, sinus Caldwell. Hence, the Caldwell is always going to be in the lower third of the orbit. If you see the word Caldwell, you know where the Petrus ridges are supposed to be. If they're inferior to the maxillary sinus, again, look at the same words. Facial bones Waters, sinus Waters. Right? The only outlier here usually, and this would be a modified situation, but a modified Waters, which is a little bit of change in degrees here, is in the lower half of the maxillary sinus. Malhala or hang 10, if you remember, this is how I determine if the Petrus ridges are in the right location. And this is from lab, so stick your thumbs in your ears, pinkies in front of your eyes, and if your Petrus ridges are here, and that's where you want them to be, then you stay still. If the Petrus ridges are too high and you want to lower them, you raise the head. If the Petrus ridges are too low and you want to raise them, you drop the chin. That's your trick. Review skull, the Townes, and remember the 30 or 37 degree options, and I just remember it as there's less degree for less letters. So 30 for OML, 37 IOML, and you guys know where central rays are. Caldwell is going to be your 15 degree exit at the nasion. Again, Petrus ridges lower third. Your AP axial Caldwell or your trauma one, you're just going to reverse. So remember, if their toes are up, angle up. PA or AP skull, this is going to fill the orbit. Visually, are you able to look at these two images and determine which one is AP and which one is PA? Can you compare the two and decide fairly quickly? What could you look for? And here they have identified the size of the orbits. So you can see the orbit size is larger here than this one. Why? OID, right? All right, lateral skull. You know where to center, 2 inches above EAM. You're looking at this sella turcica, or that saddle, right? Remember? When would you use cross-table? Trauma. This PA Axial Towne Method, or the reverse Townes, will be potentially used for kyphotic patients, right? If they are too kyphotic, they're going to be down like this for an AP version, so we won't be able to use that. So now they've flipped over to try and reduce the OID. It shows the occipital bone similar to that of Towne. Facial bones, again, anatomy. You're going to hear me say that again and again. Know your anatomy. Ideally, upright is preferred. Trauma to the face, we're most often looking for an air fluid level, right? Waters is always going to be your MML. Okay, so keep that in mind. You want that chin on the board. And remember, waters is like you're coming out of the pool of water and you're looking up to take a breath, so your patient's going to be chin up. Caldwell is always going to be that 15 degrees, right? Ridge is in that lower third. The modified waters. Sinuses, what's the key to sinuses? Is that you want the patient to be upright. You want some air fluid levels going on. So review those. Try not to photo time. Most often it'll overexpose your image. The open mouth waters is your alternate for SMV. If the patient can't go all the way back, right, you can try that open mouth waters. In a trauma situation or a patient unable to stand, you could only do a cross table lateral. And the lateral is the one where you can see all four sinuses. So review those. Mandible. PA mandible, you're going to use OML, and that's we're going to exit out the lips. The Towne is similar to the Towne of the skull. Instead of 30 and 37, it's 35 and 42. And remember what you're looking at here for the process. And obliques. Textbook oblique, you're going to use a 25-degree cephalic angle. It demonstrates the side closest. So true lateral, straight on with just the tube angles, the ramus. 30 degrees toward is the body. 45 is the mentum. Just think steeper degree, more anterior here. So this is your 45. A little bit less is the body for 30. The 10 to 15 is just the general survey. SMV, for almost all the SMVs, or I think all the SMVs, it's IOML, is parallel to your image receptor there. TMJs. I really don't foresee you getting many questions about TMJs, if you even get one, but the thing to know definitely is you want open and closed mouth views on TMJ exams. Arches, nasal bones, orbits. I think you would see very minimal, if any, on this, but it's definitely review. So for the zygomatic arches, you're going to be in that SMV position, and I use TART, so turn away, rotate towards. Nasal bones, Waters, Caldwell, you're going to do both laterals, because remember, both sides of the nasal bone, ideally preferred non-grid, because of it's less dense, okay? Orbits, Reese view, the three-point landing is actually not on the content specs, which is usually the only orbits view that we retain, right? But so very similar to facial bones.